As an entrepreneur, Mr. Raj Vattikuti envisaged special development programs for rural India, and the foundation has been focusing on creating infrastructure, both physical and information-based, that will deliver last-mile services to the community through community-centered technology. And a pilot project is already up and running in Tumkur district of Karnataka, covering around 24,000 families. Raj and Padma Vattikuti work closely with their team on every new project, shape the foundation strategy, and also provide overall direction to the whole organization. Let's hear it from the man himself, Mr. Raj Vattikuti, about his life's mission.
Distinguished guests, Dr. Alwalia, Dr. Trehan, and the rest of the guests, and welcome you all to our first multi-specialty robotic conference. It's really a dream, and in a short time frame, we try to put this thing together. And especially I want to thank the faculty came from all over the world and try to participate and really disseminate the knowledge they have. The key thing is for us, the foundation, we not only just believe in it, we really feel this is the way to go moving forward. And most important of all, how do we make sure this reaches to the common person? We have great surgeons in India, one of the best in terms of many ways, and how do we leverage them in terms of using these technologies and be able to master the techniques as well as building the new techniques. There's many parts of the world where you could not do a lot of things, but in India we could do and experiment a lot of the new techniques, and we feel eventually India will be the innovation center for the robotic surgery. So we're working very closely with the Manufacturers Institute in terms of how do we make it more economical, not only the price of the robot, but also the instruments, higher usage than normally permitted, which we're very close to getting that done. And hopefully within the next 30 to 60 days, we should be able to help the institutions where they can use these instruments more than normally permitted, which will bring the cost down. And at the same time, the foundation is very committed to building the clinical expertise, and where we have network of surgeons all over the world, like for this conference, ability to not only proctor the techniques for the surgeons, but making sure that they come up to speed, and also ability to do these surgeries. And the other aspect of the foundation is to quality program. It's, Dr. Menon talked a lot about it. It's very important. Unless we capture all the outcomes, and people won't know what the difference is. Not just the surgeons, but the patients need to understand what has really helped them in terms of the care. So this is where another aspect we are very focused. And we also building, in India, we set up a team now to capture the state-of-the-art, these techniques, different techniques, in a video library, so people can from any place can view these techniques and try to learn them. We also now will be inaugurating sometime by end of this month, for the first week of February, a brand new training institute in Chennai, which will provide which has the wet lab and dry lab, will provide the training right here in India, so that you don't have to travel to US or Europe. So there's a lot of ways which the foundation is made the commitment and making sure these next 3 to 4 years, this technology is widespread and ability to also reach to the common person in India. So we're very excited, and personally I see this will happen. Personally for me, and by 2016, we hope to do at least 30,000 surgeries a year by using this new technology, which is nothing compared to the number of surgeries we do in India, and how do we make the difference. The key thing is for institutions to believe in it, surgeons to believe in it. You don't need everybody to adopt it. You need to focus on the areas which can really make the difference using robotic surgery. In no time, you'll be able to make this very viable and economic model. I'm going to talk about that later on in more detail. Again, welcome to the great conference, and looking forward to interacting with many of you during the conference, and wish you all the best. Thank you.